signs of prostate cancer?
Usually urinary symptoms. I mean, like going to the bathroom very frequent, and the urine stream is become slow, or when they go to the bathroom, they feel still the bladder is not empty, still there is dripping. Those are the symptoms. But those symptoms are, it's better not to wait for those symptoms.
Sure.
Usually there is a screening for it from the just physical exam, and
you could go just a family practitioner.
Yeah, family practitioner can do the just the rectal exam, and there is a blood test now, which is called PSA, which is just a blood test. Screening, and they can tell if there is a prostate cancer or not. And that blood test should be done annually, once a year. Should have it done.
Okay, breast cancer. Now let's go back to women and breast cancer, which is very common for women than men.
That's right. And women, they develop breast cancer, same scenario, because they have breast and they have the hormones, which is the estrogen hormone, which is a woman hormone, and that's why they develop breast cancer more than men. By the way, men develop breast cancer too, but very rare. And breast cancer in women, there is the hereditary breast cancer that's running the family, and the common is non-hereditary, just happen. And breast cancer is one of the cancers that is we can prevent, we can detect very early by doing simply mammogram.
Now we'll find a relationship between breast cancer, women breast cancer, and non-breastfeeding.
Breast cancer in general is caused by estrogen hormones. So the longer the period the woman exposed to estrogen, the more likely develop cancer. And that means if during breastfeeding there is no estrogen, I mean there is estrogen production, but it's not high, because women most likely do not. Women do not menstruate during breastfeeding, so there is less exposure to estrogen. Also, women who never get pregnant, they're exposed to estrogen more than others. So exposure to estrogen is a key. The more exposed to estrogen, the more likely to develop breast cancer.
So what you're saying is so amazing, because by nature, we as men and women, we need to get married by nature. I mean, for continuation of life, circle and life. And women who get pregnant and have babies, by nature, they need to breastfeed their babies, because by nature, again, that could be a key prevention or a route for prevention of causing cancer, for breast cancer for women then.
I agree.
Because of it's a godly creation thing.
Yes, I agree.
It's amazing. Let's talk about some of the prevention when it comes to all these different diseases, cancer, different types of cancers, and prevention. What would be your best advice? Let's start from young age all the way to elderly.
When we say prevention for cancer, if I start with lung cancer, very simple.
No smoking.
No smoking. And if we think how much it costs to treat a lung cancer patient, a lot of money, just from chemotherapy test, and how much to prevent. It just don't smoke.
So in addition to the smokers burn their own wealth and they burn their own money, they also burn their own lungs, and then at the end they shout and they scream, because they go through a very harsh treatment, and that takes us actually to a chemotherapy.
Yes.
So that's one of the treatments.
Let me go back to the prevention. So for lung cancer, actually, I'm sure everyone knows that smoking causes lung cancer, but people still continue to smoke. My patients who have lung cancer, sometimes they continue to smoke during treatment after having cancer.
Is it a habit, or they just gave up, you think?
I think I would say a habit. If I have someone who had the cancer that is spread to the brain, all over the body, I may say, well, their chance is very slim. But if I have someone who has cancer that has been removed, I don't see a reason why still they smoke. But I do see that, of course, most of the patients who develop lung cancer, most of them, they quit smoking the day of diagnosis. If you ask them, when you quit cancer, they say yesterday when they found cancer. So most of the people,
is it too late?
Actually, no, because once someone develops cancer, people who continue to smoke, they respond less to treatment, and they develop a second cancer once they have it. So if they quit smoking, first of all, the result from our treatment is better. Number two, they don't develop the second cancer in the lung. Talk about early cancer that is treatable.
What about some of those smokers who live until they're 80 or 90, and they say, well, I've lived for 90 years as a smoker, and look at, somebody died at the age of 60, not a smoker. Sometimes they take that as an excuse to continue smoking.
Well, I look at it from another angle, or is if you look in this country, every year there is 170,000 new cases of lung cancer.
Wow.
Yes, 170,000 new cases every year. So if they say, I smoke but I never get it, I guess you are lucky.
So if you are 90 years old and you are still a smoker, you are a rare case in the U.S. So quit smoking. Arlene, good evening.
Hello.
Hi, how are you?
Fine. I wondered if you would discuss brain cancer any.
Brain cancer?
Yes. My daughter has blastoma, multiform, something like that. Would you discuss that a little bit? I'll hang up and listen.
Okay, thanks, Arlene. Keep watching.
Thank you.
Well, brain tumor, glioblastoma multiforme, is one type of brain cancer, and from its name, the glioblastoma multiforme is cancer that, if you will, we can call it has fingers. That means it is not really like a one piece of tumor. It attached to the neighbors. So that cancer, of course, the best treatment is surgery. Try to remove it if possible. But even removing that, is still the patient need more treatment, which is a radiation to the brain, and specifically to the tumor bed, to prevent